So if you've been asked to set up an arterial line for a doctor, the idea is get your kit ready first. So as in the previous video we showed you, there's actually an arterial line trolley. So you'd actually bring that to the patient's side because you clean it down, you've then got your flat surface to set up a sterile field on the top. And all the kit that you'll need to do that is in that trolley. So you will obviously have the arterial line, whichever the doctor prefers, and actually what I would suggest is that they'll get their own stuff out. Just a little handy tip, if these ones are used, it does have an on-off valve, so if you can't get your arterial line to work, sometimes it's because it's been left in the off position and it just needs sliding to the on position. But before all of that happens, it's helpful for the doctor if you get the arterial line actually run through. So the pieces of kit that you're going to need is a bag of 500 of normal saline, in date obviously, and check that with the doctor that's putting the arterial line in. So between the two of you, you know categorically, and then obviously that will be prescribed on EPMA for you to sign as well. That needs to go into a pressure bag. You'll need your transducer set, which attaches the arterial line that's in the patient through to the fluids, and then your wiring that will attach the arterial line ultimately to the monitor so that you can invasively measure their blood pressure. So that's the kit really that you need. And finally, these are, some people like them, some people don't, but this is called a contact board. This attaches to the drip stand, and it's so that you can keep the transducer set level with the patient's heart. Some doctors prefer you to tape it to the patient's shoulder or the side of the bed, but you can slide it into here and have that level with the patient's heart. Okay, so to run it through, my bag of fluid is going to go into my uninflated pressure bag and attached to the clip at the top. And I'm going to, obviously I would have washed my hands, have my PPE on and gloves, and have some alcohol hand gel handy. So I'm going to open up my set. I will not throw these little handy coloured stickers away because they're useful. And so I have got a giving set at the top that looks like the top of any other giving set, just here. So I'm going to turn my roller clamp off, and then I've got the transducer set here where I've got my wiring that will attach to this wiring, and then I've got the tubing that attaches to the patient's arterial cannula, wherever that's been sited. So my roller clamp is off. That's ready to go into my bag of fluid, obviously using aseptic non-touch technique. Into the fluid bag, and then I can hang that on my drip stand, which I haven't prepared, but I can do it here onto my drip stand. Perfect. So the next thing I need to do is to inflate the pressure bag around the bag of fluid. So looking at this here, I need to have it off to the air inlet here. There's an off sign here, and then my pressure bag will inflate, and the tighter it gets, the more this little, I don't even know what you call it, sticks out. And you want to keep going, keep going, keep going, keep inflating until this little gauge comes into the green there. So you can just see that's green here. So that's the right pressure to be against the flow of the artery. So once that's run through, I like to spread myself out so I can see. I can turn on this roller clamp because I've got also a safety clamp down here, so it won't suddenly run through, she says, but it is running through. So, as you run this through, you want to make sure you haven't got any air. So it's, again, this is covered, so for your aseptic non-touch technique, the end is covered here. I can pop that in a bowl, and then just here, I pull this little blue rubbery valve, And as I pull this, because this is under pressure, it will run that through quite swiftly, and I can just see that there's a couple of air bubbles. So I'm going to run this all the way through until I've got fluid coming out at the end, but also no air bubbles in that tubing. So I'm just watching those last few air bubbles come through and out here now. Lovely. So there is now, I just scan all the way along, just making sure I don't have any air bubbles all the way up. Now for safety, I'm now going to put the roller clamp back on. This essentially is an arterial line run through, ready for the doctor to attach to the arterial cannula once it's in situ. So we now need to attach the arterial line that's attached to the arterial cannula to the monitor so we can invasively measure their blood pressure. So we're going to imagine this is the patient's arm, obviously, and this end is attached to the arterial cannula. And I've got the port here that on some of the more modern cannulation transducer sets comes with a syringe attached to it, ready to take your first blood gas. This is one of the older sets that I'm using for training purposes. So we have got this bit here where we've got an off switch that is off to the air inlet, if that makes sense, or the part where you can attach a syringe to take arterial blood to run a gas or whatever. So I've taped this to the patient's gown so it's easy to find, it's easy to see, and I'm going to need that in a second to zero the machine so I can set it to do invasive blood pressure. So this is my beautifully tidied wiring. So do you remember I said before that we would use a contact board? Some people like them, some people don't. So this part of the transducer set just literally slides into this, and we'll imagine that there is a patient on the bed that's quite a thick set patient, and so the chest sits about here. Maybe we would lower it slightly to be level, for this to be level with the patient's heart. This then runs to the patient. Preferably you would put that on the same side as the patient's arm, sorry, that the cannula is. And then this is the part I'm going to attach to our machinery. So this wiring very clearly isn't part of the giving set because it's completely opaque, and only one end of this wire will attach to this port just here. The other end of this wire will then attach into the side of our Philips monitoring, and the part of the monitor that slides into the back that has got the CO2 monitoring below it. So it's into this port here. This wire attaches just here. Try not to break the machine as you go. Fabulous. So that's now attaching the transducer set that is attached to the patient's cannula, therefore their arterial system, connects it all up to this machinery. I turn my machinery on, and it should automatically detect that I've attached an arterial line to the machine, and it's giving me my red trace here, arterial line here, and it says nothing because at the moment it's not picking up anything from the patient. So you'll hear people refer to zeroing the machine, and by zeroing it, you're starting it from scratch. It will then detect the invasive blood pressure. So along my bottom bank here, I've got a 0 button, but if that doesn't appear because the system is set up slightly differently, you can press the actual screen where it says 0 art. That's a separate way you can press the 0 button. Okay, so the first thing you will hear people refer to always when zeroing an arterial line or even a central line, they will talk about off to patient, open to air. So that takes us back to this part here that I've taped nicely, easy for me to find. Now this part of the giving set goes to the patient, and remember I have my off tap here. So I'm going to turn it off to the patient. I'm going to open it to air. I'm not going to completely remove this because I want to keep it as aseptic as possible. So I'm just releasing that, so it's now open to the air, and I then zero my arterial line, and the machine will then try and pick up an invasive blood pressure. Once it says 0, which this isn't going to do because there's no artery really attached, she lies, it has said 0. So that's now zeroed. So I then go off to air, so I've tightened this one, off to air, open to patient, so I've put my off tap to the air to be 100% certain, so it's now open, the giving set runs through to my patient, and the machine will then find the arterial blood pressure invasively. And so at the moment it's not doing that because there is no blood pressure, it's a blanket, but that's when your blood pressure will appear on the machine. And finally, the things I've saved are some caps to go on different ports if they get lost, to keep the different ports throughout the system clean, and also to attach to end of cannulas if you're disconnecting it, etc. So keep those because they're clean in here. And I've also kept my stickers, and I like the stickers for many reasons, but from a human factors point of view, you've got one here that says arterial, so I tend to take that one off and put that on my roller clamp here. If we end up with lots of different bags of fluid with lots of different roller clamps, it makes it really obvious which one is attached to my arterial line. You've then got the spots, and it's handy to use the spots on the pressure bag, so it's obvious this one, red indicates arterial, and also once you come down nearer to the patient, you can actually put some of the red spots there to indicate that this is the arterial giving set, because we would never want to put any form of drugs through an arterial line.